Hello, I am Assemblywoman Inez E. Dickens, and today we have the topic about the COVID-19 and the vaccinations. The purpose of today's discussion is to highlight through various institutions the importance of building trust within the community of the ability of the COVID-19 vaccine to deliver safe and viable results, to address community concerns of the disparities that currently exist within underserved communities, and to ensure that they will receive any and all resources needed, to lay out in detail each above named institutions' plans to assist in that effort, and what role will elected officials play and their offices in that effort. I want to thank Manhattan Neighborhood Network and Victoria Burt and Francis Brewy for allowing us to have this time, which is so important. We have participating today Assemblymember Al Taylor of the 71st Assembly District, Washington Heights, Assemblymember Robert Rodriguez, 68th Assembly District, East Harlem, and the panelists that we have that have joined us to help us understand and get through this malaise of what fears we have is Dr. Ayman El-Mohandes, Dean of the CUNY Graduate School of Public Health and Health Policy. We also have with us John Padmore, who is the Action Center Manager, Center for Health Equity, Harlem Neighborhood Health Action Center at DOHMH. I want to just take this opportunity to also thank Dr. Malcolm Punter for putting me in contact with everyone here so that I would be able to do what's best. Now, let's open this up rather quickly, and I'd like to, hear from you, John, about the mobile units, what you're doing in the community in order to alleviate some of the fears that people have about doing this.
Good morning, everyone. Good afternoon. Thank you, Assemblymember Dickens, the other elected officials, and Manhattan Neighborhood Network in being able to provide this as a resource to the community. I appreciate it all, and thank you so much. One of the things that we have been able to do in terms of ensuring that, and I want to just also start with the fact that we have been seeing a rising trend in cases and hospitalizations over the past weeks. As you know, the Department of Health is looking at the percent positivity over the past 7 days, over a 7-day period. And unfortunately, it continues to be above 5% for the majority of the Harlem neighborhoods and zip codes. So we want to make sure and pass on the message that everyone continue to practice the core 4, which is to keep their wear masks when you're going outside, to keep a 6-foot distance, social distancing, wash your hands often when you can, utilize sanitizers, and of course, stay home if you are sick. And the key component of that as well is, of course, continuing to be tested. One of the things that we have been able to do is ensure that, one, that there are the large sites of testing at the hospitals and pharmacies, of course, but also being able to provide microsites, which is being done as part of the with the test and trace from Health and Hospitals Corporation, and mobile sites. One of the key things we have been able to do is work with various local providers, including our very own Dr. Thornton, which has been able to have sites across various locations in Harlem that allows everyone to be able to get tested for the virus free of charge. And I think that's very important for everyone knows that this is available as a resource. You can go on testing sites, just do a Google search, nyc.gov/testing. You'll be able to see all the locations where the testing sites are available, whether it's a microsite, whether it's a mobile site, or it's a large facility where you can conduct testing. So I think it's very important that everyone is aware of those locations.
I have a question on that because when I went online, I saw that Bobby, Assemblymember Rodriguez, and our districts had quite a number of testing sites as well as vaccine sites. But I didn't see as many for Reverend Assemblymember Al Taylor's district. Al, you have a question about that?
Never a question. I'm the stepchild. We took, and I say that in all sincerity because when this peaked, it took us till June or July before there was a brick and mortar test site in the 71st Assembly District. Now that's excluding a couple of days that they did at Convent, a couple of days that they did at St. Matthew Baptist Church, but there was no brick and mortar place in the 71st Assembly District. They were south of the 71st, they were north in multiple places, but yet none. So I'm not surprised. But again, it's one of the most impacted communities where the virus is continuing to excel, and we need more. We have a lot of mobile. I want to say thank God for Dr. Thornton, who's been like, I don't know if she goes home because we have her moving. And we just came in contact with another gentleman that has mobile vehicles. So we're rolling them out. And on tomorrow, I hope to report where there's more testing sites. They did do a pop-up in the Polo Grounds, which I think was more a horse and buggy show, because when they rolled out to bring the 500 vaccinations 2 days in a row, the individuals that lived there were not properly informed. So the media and more cops and media were there than there were people to take the vaccination schedule. So there's a disconnect in terms of what the residents and the constituents need versus what is being offered. And you're absolutely right. It doesn't exist to the level that it needs to.
Well, in all fairness, HCCI, Holland Congregations for Community Improvement, and Dr. Malcolm Punter held a community town hall and brought in the residents of Polo Grounds and Wrangle houses in order to let them know what was going on. Bobby, I know that there's been concern and discussion about the fact that we don't have sufficient vaccines, that we've lost some have been destroyed, some have died out, some, whatever, we didn't get it. Now, in your district, tell me what's going on in your district about that.
So that's interesting. So we have been following the governor's plan in terms of the 1A and the 1B rollout, which is basically making sure that essential workers, frontline workers, transit workers, all the folks who are out there performing essential jobs are getting vaccinated. What we have heard anecdotally is like, of course, as we increase that pool to include 65 folks who are over 75 and then over 65, that the demand has dramatically exceeded the supply of vaccines. So we know, notwithstanding that there is a huge supply and demand problem and not enough vaccines coming in, one of the things that we have been focusing on is making sure that there is equity in the distribution. And I appreciate Padmore for mentioning that, because the push that we have been saying is that we have senior development, senior NYCHA units. We did the rollout as well at Corsi houses, similar to what the Assemblymember Taylor was mentioning, to try and make sure that we start to target these specific developments where we can get a high amount of penetration among seniors who are vulnerable. And that needs to be the ongoing strategy. But what we also know, which I know that the doctor is going to focus on, is there's still an incredible education campaign that needs to happen amongst our community members. And I think what our concern is, we do have some vaccination sites. We've got Metropolitan Hospital, we've got Mount Sinai, and it's important, for us to make sure that people are comfortable signing up. Otherwise, this equity conversation doesn't exist, because folks from other communities are going to sign up and take all the spots, and folks from our community are going to be hemming and hawing about whether or not we should even be making that call. And I say that out of personal experience. I had to have that conversation with my own mother about, I understand you're almost 70. You need to make the call and get on the list. This is why you should. I know we have other issues and other medications and other potential things that we might be worried about, but it's more important that you sign up and have a spot and get the vaccine than if you leave yourself exposed. So I think that's an important message that we have to talk about. And that's a note to self. I got to go check in on my mother and make sure she got her shots.
Dr. El-Mohandes, question about the vaccine and the virus. Now, there was an announcement a few days ago, because we know we had COVID-19, SARS. We also had the UK came into the United States, into New York State and New York City. And then we heard about the South African, and we heard about the Brazilian. Now it was announced about 2 days ago that the Brazilian, which the governor had told us was the worst of the SARS, was had hit into America, into the United States, out in the Midwest. Can you tell us something about that? And will the current vaccine that we're being given by Pfizer and the other one, I can't remember who's the
Moderna.
other, Moderna, or the one that's being proposed by Johnson and Johnson, whether they will be effective against the Brazilian if it starts to spread to other states?
Well, I'll answer this question a little bit differently. And I will tell you that the sooner we all get vaccinated, the less these new variants will appear. The more we allow for this virus to circulate amongst us, the more of these new mutations and these new variants will appear. That is the nature of the virus. For the time being, it does seem like the vaccine is effective. It would not surprise me if we continue to allow the virus to circulate, that new variants will appear that could be resistant. And so the answer to your question is going to be, as far as we can tell, we have not had a serious problem yet. There is a question about the South African variant, whether the vaccine is as effective. But the only way to deal with this is to have as many of us vaccinated as possible. So each one of us becomes a firewall to the virus. And this way, the virus is not allowed to circulate amongst us in our bodies and produce new variants that will challenge us more and more. So at the end of the day, the answer to your question is, for the time being, we don't have a clear indication that the vaccine is not working. And what we know is the more of us that get vaccinated and the sooner we do it, the less likely it is for new variants to appear that are going to challenge us in the future.
So now you're telling me that the mutations or the variants that we've been hearing about comes about because it's been spreading wherever. It's been spreading with people, with humans. Is that correct?
Exactly, amongst us.
Mm-hmm. All right, Al Taylor, do you have a question for Dr. El-Mohandes?
Yes, thank you. Very informative. What would you say to the people, that doctors that are saying, because this is part of the myth and why it's hard to my colleague, Assemblymember Rodriguez speaks about getting the community to buy in. There was a doctor, I can't remember his name, but he said this, and I need your clarity, it's not a vaccine. It's a combination of everything but a vaccine, and it should be called that and not called the vaccine. Can you dispel that? Have you heard? Am I making any kind of sense?
I don't know who that person was, to be honest with you. At the end of the day, a vaccine is a substance that is made out of a pathogen, a virus or a bacteria, either all of it, part of it, or artificially manufactured molecule similar to it that allows the body to produce an immunity against that infectious agent. That's what a vaccine is. This is a vaccine. It is a manufactured molecule that allows the body to form antibodies against the virus. That's what it is. And, you know, there's a lot of talk about contraindications and so on. And the only contraindication that we know of at this present moment is some people are allergic to one of the constituents of the vaccine, something like polyethylene glycol, a chemical inside the vaccine, not people who are allergic to cats or dogs or corn dust or molds. These allergies don't count. We're talking about people that are allergic to the vaccine itself, mainly people that develop a serious allergic reaction after the first dose. In that case, this is a contraindication, and that is the only contraindication that we see. Currently, this vaccine doesn't have a live virus. In some instances, people that have low immunity or receiving chemotherapy that lowers their immunity, these people should not receive a live virus because their immunity is so weak that even if the virus is weakened in some of the vaccines, it might affect them. This is not that kind of a vaccine. And there is no reason for people who are immune compromised not to receive it.
Excellent.
On the other hand, it is not clear, because they're immune compromised, that they will mount the same degree of immunity that somebody that has a healthy immune system will. So it's not that the vaccine is contraindicated, it is that if they receive the vaccine, they may not have the amount of antibodies produced as somebody with a strong immune system.
Understood. Thank you so much.
Bobby, I know that you've had a lot of difficulty in East Harlem, as the rest of us did in West Harlem, Washington Heights, the Black and Brown communities. Do you have a specific question about not only the distribution of the vaccine, but maybe is it a cure, or is it a vaccine for Dr. El-Mohandes? Bobby?
Yeah, I think what's circulating in our community is a lot of misinformation about what the vaccine is, right? And how it would impact people, and the process for doing that. So I mean, if you could just comment on what it is and what it isn't, and speak to people about the contraindications. What does that mean, about whether or not they have a pre-existing condition?
Well, first of all, I think that when you register to take the vaccine, and I registered, and I'm taking the vaccine at 3 o'clock today. So wish me luck.
Good luck.
Good luck.
When you register to take the vaccine, they ask you about all your medical conditions. They ask you about allergies, and they ask you about your medications. It is suggested, I did that yesterday, I filled in all the forms that they needed ahead of time so that they know everything about you before you show up to get the vaccine, number one. Number two, as I just mentioned, we don't know of medical contraindications outside of allergies to the vaccine itself. And that would be a contraindication. Otherwise, none have been declared so far. They would like to make sure that frail people and people that have chronic illnesses are protected from COVID, because COVID has killed more people who are elderly and frail and have health conditions than people who are healthy. So I will turn this argument around and tell you, please, if you have somebody who is frail, who belongs to the categories that we describe, that person should be immunized, because this virus has killed a lot of people who are weak and have chronic conditions and are elderly. There have been questions about pregnant women, and there is no contraindication for pregnant women to receive that vaccine. In fact, what we know so far is that pregnant women, when they get the COVID virus, get sicker than other people. And so we would like to protect them and protect the unborn child. Going back to the allergy question, those that will demonstrate allergy to the vaccine itself will demonstrate it within 30 minutes of receiving the vaccine. And now, when you go and get a shot, They will ask you to wait for 30 minutes so that they can observe you. If you have a history of very severe allergies and you have an EpiPen at home, take it with you in case you need it. And that is the only situation that we know of today that could cause you not to receive the second shot. In other situations, most of the people that have received the vaccine will say that they will have a local reaction. It might get red or swollen or a little bit painful. Some have said that they feel fatigued, a little bit tired after receiving the vaccine, or might have a very slight elevation in temperature. But these are symptoms that tell you that your body is working hard in making the antibodies. So they are not supposed to be cause for alarm. But if you have any serious symptoms, of course, you should get in touch with your physician.
Now, John, and I want to get back to you, Doctor, because I got another question, but I want to ask John, the mayor has announced, New York City Mayor de Blasio has announced that he's launching for NYC seniors, a night shift vaccination site for residents 65 and over. Yet then we heard from the governor that we were running low on vaccine, and that maybe we might wind up only taking one dose. So can you explain that? And also, John, does that mean that if we only can take the first dose, has a reserve of the second dose been saved, or will one dose be enough?
No, thank you. So there was still the continuation for everyone to get 2 doses. You're not, unless you have the 2 doses, you won't be approaching full immunization. The nature, the way it has been done, and New York City is getting allotments of vaccinations on a weekly basis. And typically these allotments are being assigned to very specific appointments that are being given. So what we want to be able to do is to make sure that individuals are still getting their first and their second dose. So that will be addressed. To be able to ensure that other individuals that are coming online, one, this is about being able to get a larger amount to accommodate the newer ones, but also just to ensure that those who have appointments, they are able to maintain those appointments. But there will not be any no access. There will still be access for that second dose. So this is something that is being calculated into the number of doses that are being received and the number of appointments that are being opened up. And that's important because I know sometimes individuals are going online. And I want to also give a few steps to being able to get vaccinated as well. But individuals may go online and may not be able to get an appointment. So the reason they're not able to get an appointment, unfortunately, just because there's not enough vaccinations to be able to meet that demand. So that's one of the challenges that we have been having is the supply issue, but we are looking to be able to ensure that everyone for the number of vaccines that we have, that there is an eligible appointment available for each of those vaccinations. So just in terms of the process of getting vaccinated, there are a few steps that individuals will have to take. The first thing to do is to make sure that you're eligible. There is a website, nyc.gov/COVID vaccine distribution, that gives the list of eligible individuals. Obviously, we know that began with healthcare workers, and then there were residents and staff in certain group living facilities. Of course, now that has been opened up to older adults, grocery workers, first responders and support staff for the first responder agencies, corrections, P-12 schools, college, childcare and early intervention, public transit, homeless shelters, and other residential programs of supportive housing. So everyone who is part of those groups I listed are eligible to be able to get the vaccine at this point.
John, I want to put a pin in that because I want to ask a question that's very important about about that, about the 1A and 1B, the first responders, etc. In addition to that, the issue that I'm talking about is, and or the fear of so many people is, what do I do if they don't have the second one? What do I do if I follow you and I can't get the second dose? And the second thing is, there's been so many requests that the people who are the members of, say, 32BJ, who go into people's homes to make repairs, they are not vaccinated. And so they maybe should be have been thought, and I don't know whether that could be under consideration, but they may be, and as well as ministers. What about ministers? Because they go to help families to, not just in times of loss, but in times of fear. So can you?
Yeah, so I will start with that point of it in terms of the second vaccines. Just recently, some second vaccine appointments were rescheduled. For both of them, for both of the vaccines that are being that are being authorized under the emergency use authorization, there is basically a 3-week to 6-week window to get those vaccines. Between 21 days for Moderna, and Pfizer, 28 for Pfizer, and up to 6 weeks later, 42 days that you are given that window to get that second vaccine. So if you have received that first dose, and I know some folks may have had their second dose scheduled, it may have been rescheduled, but you will be getting that second dose within that window. Everyone who has received their first dose, allocations are being made to ensure that you get that second dose. So that's really important for everyone to know. You will not be able to get that second dose. You will get that second dose. That's very important. In terms of the eligibility of some of the individuals that you indicated, individuals that go into houses and ministers and such, unfortunately, it's the guidance that is coming down to the city in terms of who are some of the eligible individuals is first coming from a CDC and then being made by the state. So if we're identifying certain populations that may become eligible, it's really for determination by the state to be able to say that these individuals are not eligible and they will be opened up. At this point in time, the city Department of Health is not able to make those determinations.
All right, I know that Bobby has some questions for you, but I just have a question for Dr. El-Mohandes. If you take the first vaccine and you don't get the second, for whatever reason, not available, or you don't go back, will the contact tracers contact you? That's number one. Or if you don't go back, what does that mean? And then Bobby, you'll pick it up from there, please.
Yeah, as John said, I think the backup of vaccine doses available to us is taking into consideration that everybody that takes the first dose will have the second dose available to them. There will be situations where, for one reason or the other, you're not able to receive the second dose, and these things do happen, but then in that case, it is not assured that your immunity is complete. The level of antibodies could be lower, and the duration of your immunity could be shorter. And so in that cases, we need to wait and see, but I am sure that the advice will be to start the immunization schedule from scratch, meaning to get the first and second dose again. The interval that one has to wait, I'm not sure of at the present moment, but this vaccine is intended to be a 2-dose vaccine, and both of them should be received. There is a new vaccine by Johnson & Johnson, and it's a different kind of vaccine. It's called an adenovirus vector vaccine, where a friendly virus is used to carry part of this dangerous virus into the human cell, and again, mounting an immune response. And it could be a 1-dose vaccine, which could be different, but the 2 vaccines that are being offered at the present moment are both intended to be received in 2 doses.
All right, well, thank you so much. I want to just say one thing, Bobby, before you get on. We've been joined by Dr. Natash Williams, hi, how are you? How are you? Thank you so much for coming. I know that you've been so very, 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 very busy, and I'm so glad that you know, have the opportunity to join us. I just want to rather quickly say, Dr. Williams is the Assistant Professor, Division of Health and Behavior, Graduate Advisor, Population Health, in the PhD program, Department of Population Health Center for Healthful Behavior Change at NYU Grossman School of Medicine. So do you want to add something to that before Bobby gets in his questions? Natasha, please.
No, just to say, thank goodness for Facebook Live. So I was able to follow along with the conversation before I got in through Zoom. So I'm glad that you all are really answering these important questions that members of the community have. So thank you.
Do you get, Natasha, when they talked about the symptoms with the first injection of the vaccine, do you get similar symptoms with the second?
So in full disclosure, I'm not an MD, so my doctorate is in health and behavior studies.
Mm-hmm.
I can tell you, and I hope someone will verify this, anecdotally, what I've been told from many of my colleagues who have been vaccinated is that they do experience symptoms from the second dose, and the symptoms vary based on the individual, and why that may occur. I would only imagine that it has more to do with an individual's perhaps immune system. So those are my initial thoughts about it, but welcome others to chime in as well.
All right, Bobby.
Yeah, so I think what we gathered from this conversation, or at least what I'm taking away, is it's a little bit of a race against time in terms of making sure that we get a lot of people vaccinated to prevent some of the variants, and that it's very, very safe in terms of what's being provided. So now the next step, John or somebody, is how do I sign up? Who do I call? What number do I dial? You know, my seniors who are, you know, who are listening to this may be tech savvy or maybe not. So if you could give that information, you know, before we run out of time.
Absolutely, thank you. So again, we just want to make sure that because of the limited supply, that there are eligible groups, right? So there are priority groups, and right now I gave a listing of some of those groups. So just to make sure that you are part of that eligibility group. If you are part of that eligibility group, you can then go to this website, vaccinefinder.nyc.gov, or you can call the number 877-829-4692. 877-829-4692. So that's your second step, the vaccine finder at nyc.gov, or this number. The vaccine finder allows you to see, once you go on, if you go online, it allows you to see all the different spaces in the neighborhood that are providing, the sites that are giving the vaccination. So you can look to schedule an appointment right there online. If you have difficulty in doing that, the number will be able to do that for you, and you'll be able to get a live call and speak to someone in person that will be able to help you schedule that number. One of the other things that you have to do as well is to complete the New York State vaccine form. You can do that at the site when you get there, but it's also best to get that done prior. So again, if you're able to get online, you can go to vaccineform.health.ny.gov. vaccineform.health.ny.gov. That is just to be able to provide some background information about yourself. At all of the sites, and I think it's very important that everyone notice, you should not be paying anything. There is no charge to get vaccinated. There is no charge for the vaccination, okay? You will be expected to bring an ID. If you are in one of the eligible groups that you do not have a very specific job ID, you can bring a letter from your employer, or you can bring a pay stub, which is indicating that you are in a particular job that allows you to be part of the eligible group. And then I think it's also everyone, that when you go to get that first dose, there is a time after you have received that first dose where you can speak to someone at the site to set up your second dose vaccination appointment. Okay, you will receive a card that indicates the date that you have to come back. It tells you the type of drug, the vaccine that you received, whether it's Pfizer or Moderna, and to come back with that card so that everyone knows what you should be receiving and when your date is. If for whatever reason you have lost that card, you will be able to get a second card at the space when you're going back. And you can also call 311 to confirm your vaccination date.
Now, let me ask you something, John. If you can't are not able to go online to get that form, is it necessary for you to carry a completed form with you to the site, or can you call a number to get the form mailed to you, or can it be done on site?
That's a good question. The form, you don't need to carry the form with you. You can actually complete the form on site before you actually get the vaccination. That form does give some basic demographics, some history about you that you'll be providing to that space. So you do not have to take it with you. If you do it online, you're able to take a picture of a QR code, and they can just scan it when you get there, and that QR code lets them gain access to that form that you completed online. But if you are not able to do it online, you should be able to complete that form at the site.
Thank you. Now, Al, I know you had a question.
I'm taking my form with me.
All right. Well, I know that Al had a question. He was, questioning about whether one vaccine was better than the other. Was Moderna better than Pfizer, or was I know he had spoken to me about that, or whether Johnson & Johnson, although it hasn't been approved, will that be better because it's only one injection? So Al, go ahead.
May I?
Yes, go ahead. Go.
I think, respectfully, John just gave a very orderly way to go about getting the vaccine. And I just want to remind folks who are out there listening that we're hearing about vaccine chasers across the country. And these are primarily, my understanding, young white individuals who are waiting in line, camping out overnight at places where they can get their vaccine. If you know anything about the HIV/AIDS epidemic, you know that there were young white gay men marching in the streets on Wall Street, demanding medications for treatment. This is not the time for us to think about being passive, in my opinion, or orderly, but this is the time for us to raise our voices and there to be equity around vaccine distribution. So I'm really urging everyone who is listening to raise your voices. My parents taught me that closed mouths don't get fed. So I'm encouraging people to call 311, to call their doctors, to call the assemblymen and women, their local officials, because if there is not noise about needing the vaccine, we will be continuing to be in this situation for much longer than any of us can imagine. So I really want us to think about that. And I'm saying that respectfully because I know we need to have some order to this process, but sometimes we just need to raise our voices because this is really an urgent situation.
Thank you. But, I'd like to see about whether one is, I know that Alan had that and other questions about whether one was better than the other, but also at some point, I would like to find out how can private physicians get the vaccine in their offices so that because many times people don't want to go to a public place. They want to go to the doctor that they trust. Al, go ahead.
Yes, I definitely would like to know. Thank you, Assemblywoman. In terms of rating those three different variations of the vaccination, but also, and it's kind of piggybacking off of what the doctor just said. It's an urgent matter, but so is, and I'm not trying to diminish anything, but I want to put this out there. The flu, every year they're telling us we should make sure we take the flu shot. It's important, and this is why it's important. And I don't know, out of 100%, how many people are getting tested? 40%? They don't do it. So my question is, from a medical perspective, where do we find ourselves if we're only able to get 60% of the people in taking this vaccination, either one or both of them? What do we look like on a health perspective going forward? It's along with those three different variations. Which one is probably better than the other one? And then also, if you only get 60 to 70% of the population, where are we headed as a nation? Where are we headed as a community? Because, or should we be, from a legislative perspective, saying this must be mandatory? And I'm going into what I heard one of the airlines, major airline carriers say, their employers, they want them and they're trying to mandate that they take it. Where are we, if you can speak into that, Doctor?
Well, I'm glad you brought that up because there's proposed legislation in Albany about mandating this.
Yes.
And we get a lot of emails with people saying, you have no right to mandate that. And then you get those who say you should. So go ahead. Who's going to take that question? Don't everybody answer it once.
Well, I'll just start to say that currently we are using the vaccines under an emergency use authorization. And so at this point in time, there is no mandate, or there can't be a mandate because it's under emergency use EUA. As to what happens when it becomes in the public, that's a different question. I know in certain instances, for children, for example, and I just want to also note this, the vaccines that are currently on the market are for individuals 16 and older. So there are no children that are eligible to get the vaccine at the moment. But I know, for example, in schools, that for kids to continue going to public schools, they have to get vaccinated. So whether or not something like that will be done, I do not know. I do want to say really quickly, and this was brought up in terms of vaccines at our local providers, and that's very important, right? Because as you indicated, Assemblywoman Dickens, being able to go to your local provider instead of having to go to a space where you don't know, the local provider has your medical history, knows, have a good conversation, has been speaking with you a lot of times about your health. They're one of the best individuals to do that. And that's really important. One of the challenges to that at the moment is because, well, especially for the Pfizer requires very specific type of equipment to keep the vaccine at a particular temperature. So a lot of our local providers do not have that type of equipment to be able to do that. Moderna, it's a little bit easier. The equipment is not a cold storage freezer, which many of our providers already have, may be able to accommodate the Moderna, but for the Pfizer, it's much more difficult. And again, it goes back to the supply and demand challenge. Once we are able to have a larger supply and be able to get it into some of the neighborhood local health providers, that will really be able to be much more easier for individuals to get access, but it's definitely something that we'll be doing. Currently, the Department of Health has this citywide immunization registry where a lot of providers get other vaccines for mumps, rubella, other stuff like that, they're being able to get it out. So it will be the same process as many of our pediatricians, many of our local providers in our communities, they will be able to get those vaccines once the supply has been able to increase, and once other potential vaccines come on board, like Johnson & Johnson, which I believe does not require such a deep freeze or the special equipment to be able to do that.
Because John, there's several private physicians who have spoken with me and they have followed whatever the process is and they never got any response. Yes, no, maybe so. They got no response whatsoever.
Well, I'll be happy to touch base with them and speak to someone in what we call our Vaccine Operations Center, which is kind of running some of that, just in terms of being able to let them know why they may not have necessarily been reached out to, but also to manage their expectations, because it is a supply challenge that they are facing.
All right, we're winding down, and I'd like to give Natasha an opportunity to speak, as well as for Bobby and Al to have their last questions, and maybe they might quickly be able to tell us where in East Harlem, Bobby, you have a few of the vaccine sites, and Al, the same thing for Washington Heights and West Harlem.
Thank you. One thing that I'll just talk about briefly is about testing. This sort of speaks to Al's question. If folks are not getting vaccinated, we also need to remember that folks need to get tested. So I'm part of a program that's run with New York City Housing Authority as well as NYU Langone. And we're focused on getting testing, and specifically among NYCHA residents. So we'll be setting up testing sites with our community-based organization partners, including HCCI, as well as Henry Street Settlement. So this will be a project that we'll be running that will be led by our partners in collaboration with NYCHA, and also really spearheaded by community health workers. So our community health workers are being trained and informed about COVID, about testing, as well as the vaccine trial as well. So please be on the lookout for that project as we roll that out over the next couple of months. Testing will continue to remain important as we try to address this pandemic.
Now, Natasha, let me ask you, is this going to be at all the NYCHAs or just the senior NYCHAs?
No, these are going to be with specific NYCHA developments that our community partners are interfacing with. So there are just two that we're working with in collaboration with Henry Street Settlement. And the Polo Grounds is one that we'll be working with HCCI.
All right, thank you. All right.
Ms. Dickens, may I just intervene for just a moment? You asked about the mandate.
Yes.
And I will tell you, there is something called a legal mandate, and there is something called an ethical and social mandate. So laws are not going to mandate that we receive this vaccine. But in order for us to protect the weakest amongst us, all of us need to get vaccinated. And that's an ethical mandate. We are protecting each other in this matter. And the sooner we all get vaccinated, the more likely we are to get rid of that virus. So this is more of an ethical mandate. We are supportive of each other in our community. We stand by each other. Today, when I go and get this vaccine, I'm getting vaccinated to protect myself, but I'm also getting vaccinated to protect you. And that is my ethical mandate. I choose to get vaccinated because we are all in this together.
That was the perfect way to transition to hopefully getting some people in East Harlem vaccinated. I will give a few sites. You can look for this on the vaccine finder, but we have Metropolitan Hospital as a healthcare site. We have, of course, Mount Sinai Hospital. We have some of our federally qualified healthcare institutions like Settlement Health, Borinquen Health Center. And we do have the Department of Health building on 115th Street. Those are just a few of the sites. We have Sydenham on 118 and in Central Harlem, a few of the sites that are available in East and Central Harlem to get the vaccine for free. Please sign up, everybody.
I think I only have the city at 168th and Broadway. Columbia Presbyterian is doing some, but it's not open to the public. They're picking and choosing the clients that they do. And you have Harlem Hospital. And other than that, I'm unaware, and unless Padmore can give me some more places that he's aware of on this side of town.
John, doesn't Old Broadway, does the Manhattanville Health Center, isn't that open in West Harlem?
For testing, not vaccination at the moment.
For testing only, okay, but no vaccines, okay.
We're in the desert here. Seems familiar.
We got your back, Al. We got your back. We fight with you. We fight. We fight.
I know I got my electives. I'm just saying somebody needs to understand why we keep having this problem. I mean, we're hitting the streets with the PPEs. We're doing Community Board 9, 12, and 10. We're taking it to the streets, but we need and we demand more in our community, especially in the 71st.
Do you think, based upon what you're saying, Al, do you think that Harlem is being underserved? Because it seems like East Harlem maybe have some sites. I know in Central Harlem, we have several sites. Do you think that Harlem itself is being underserved?
I think there's something more deviant than that. Underserved is kind. I mean, if you already know what the problem is, and everybody was like, oh my goodness, look what's happening in the Black and brown communities when they saw where this was hitting. But when it came down to solutions, it's still, we're lagging behind. I think that's more than underserved. There's an intentionality to turn the other ear some kind of way. There's a blind eye. This is worse. I mean, I argued with the mayor. I called on the governor's office back and forth, and we'll get around to it. I was ready to bust a gut, and I'm still annoyed. So the science tells us there's a problem in these communities. Where is the solution? Where's the cure? Where's the help?
All right, Dr. El-Mohandes, a final statement, because we have just about a minute and a half. So you want to give a final statement?
I think families should encourage each other. We work in small units. Let's help each other overcome this barrier. There is nothing that we have seen so far that causes any of us not to go out and get vaccinated.
Please make a plan to get vaccinated. Speak with your family, speak with your healthcare provider to make sure that you're able to accommodate that.
Dr. Natasha Williams?
If you can't get vaccinated, get tested.
All right, I want to thank all of you for coming on. I want to thank particularly our panelists, our guests, John Padmore, Dr. El-Mohandes, and Dr. Natasha Williams, as well as my colleagues in Albany, Robert Rodriguez and Al Taylor. I also want to thank Deborah Levine, CUNY graduate, School of Public Health and Health Policy, for helping me to put this together. And of course, again, I thank Manhattan Network for seeing to it that we can spread the word and help people to understand. It's so very, very, very important for the survival of humanity that we are able to combat this serious pandemic that has occurred and hit not just the USA, but the world. And so I thank all of you for coming on. I thank my staff for assisting me in putting this together, particularly Nina Norwood. But thank you to each and every one of you for continuing the fight to try to get us all vaccinated and protected. Be safe, and be safe all. And again, thank you.